This Medical Monday is sponsored by the George Washington University Hospital.
This Medical Monday, we are joined by Dr. Wayne Olan, the Director of Minimally Invasive and Endovascular Neurosurgery at the George Washington University Hospital. Welcome, Dr. Olan, to Good Morning Washington.
Thank you so much for having me. I really appreciate it. What
Absolutely.
a privilege.
So tell me all about your specialty.
Where do I start? So I'm the Director of Minimally Invasive and Endovascular Neurosurgery, which really means, and in medicine, it's what the trend is. Let's do stuff quicker, more efficiently, improve recovery, and that's really what we're trying to do. That's what my specialty does. Everything is almost image guided, so we're using machines to see better. Instead of using maps, now we have really high-end GPS, so to speak. Wow. And that's what our subspecialty is. Technology is my friend. We have possibly the best technology available in medicine, and we make use of it every day.
Let's talk about that technology. How has it impacted treatment and even patient care?
Well, it changes treatment. It doesn't just impact it. We've changed it. Take stroke, for example. 5-10 years ago, stroke intervention didn't happen. Now we have the ability to really go up and change people's stars. People come in with a stroke and we can reverse it. We could take the clot out, reverse, and allow the blood to get where it needs to go. Where 10 years ago, if someone had a stroke, people would say, well, we'll see how you're doing in 2 days. We don't have that anymore. Because of technology, because of advancements, we're able to come in the middle of the night and really save somebody and save their life, their family, everything about that unit. And it's been one of the great privileges of my career. So the ability to see things that we used to not be able to see has really changed the way that we practice.
Tell me more about this technology.
The technology is the vehicle that allows us to provide this kind of care. And at GW, we're blessed to have that for not just us, but for our community. We just put in a biplane neuroangio suite that allows us to see things, but not just to see them, post-process them, give patients the most options for treatment of things. But on top of that, as you said, we have other technologies at GW that allow us to treat patients in the most advanced way.
Can you stress that importance of comprehensive care?
Well, comprehensive care means that we could take care of everything that someone may come to us with. Sort of, as we said, from the beginning to the end. And meaning from the time you make the diagnosis, meet the patient, treat the problem, but then take them back through their recovery. And I believe we have that opportunity at GW. We have the biplane neuroangio suite, which we talked about. We have intraoperative MRI, which allows my partners, the surgeons, to not only see what they're doing exactly while they're doing it, but also afterwards, during, before. And then we have focused ultrasound, which for movement disorders allows the most minimally invasive treatment for people in this massively growing diagnosis and growing problem. So the ability to provide all those things under one roof, not only helps us as clinicians, but I think also really takes care of our community and our patient population, and makes us really proud to be able to provide that because the community deserves it.
Yeah. I love that because you're giving them their life back and you're healing our community. Thank you so much for joining me, Dr. Olan.
It was so my privilege. Thanks for having me, Britt.
For sure.